our seminar series, and this today we have the ultimate pleasure of welcoming one of our very own and a former Neuro-ID alum, which is Edith Brignoni Perez. Edith, Edith is now very much interested. Now she's a postdoctoral, I should say. Now she's a postdoctoral fellow at the Developmental Behavioral Pediatrics at Stanford University School of Medicine. And her research interests are focused on human brain behavior, early development, and how experience modulates neurocognitive developmental outcomes, both in typical and atypical trajectories. Upon her graduation of her bachelor's degree in psychology here at the University of Puerto Rico, Rio Piedras, she was accepted and completed a PhD in neuroscience at Georgetown University in 2019. Her doctoral work focuses on investigating the neurofunctional basis of reading in bilingual illiterate children and young adults. And she was advised by Dr. Eden at the Center for Study of Learning. She joined the Developmental Behavioral Pediatrics Division at Stanford in July 2019, and now she's a postdoctoral advised by Dr. Feldman, Dr. Travis, and Ian Gottlieb. And Dr. Brignoni Perez's current research looks at two different developmental stages, childhood and infancy. And in children, she has addressed questions relevant to the brain's structural connectivity, which is the white matter microstructure, in relation to learning abilities, reading and spoken language. In infants, she investigated how white matter microstructure and neurodevelopmental outcomes are associated in relation to experience, and particularly infants born preterm. She also currently studies disparities in the neonatal healthcare system, as well as the impacts of an epidemic on neonatal care for at-risk infant populations. And joining Edith is Kalai Diamond, who is the program administrative manager of the doctoral neuroscience program at Stanford School of Medicine, that she will join us later to talk about their wonderful programs. So Edith, always a pleasure to see you. Thank you for coming and accepting our invitation, and we look forward to your talk.
Wonderful. Thank you so much. Thank you. And all the team, the beautiful team that BPNG always carry. It's very exciting and thrilling, and a lot of emotions I've been experiencing since the invitation because of all that it represents to me. I think that yesterday in our briefing meeting, we confirmed that relative to other speakers that you all will be seeing today, the speaker from last week and myself are a perspective more of the younger stages in career, but still a little bit more advanced than you in the postdoctoral experience. But also I can provide you what is to have been in your shoes and how can it look like in the future. So I hope that today I not only present to you some science and inspire you and introduce you to a subfield that probably you haven't heard much of it, but also I want to make sure that all of you kind of use me today, if I will say, pick my brain in anything regarding not only science, but also career development, trajectories from your current stage to all the subsequent one, including summer programs, post-bac, grad school, postdoc, and beyond, because I want to make sure that you guys can get an experience of what is to be not only in BP and JUR, but all the career opportunities that they're out there. And I'm happy that perhaps you're having a role model that I wanted back in the day and I perhaps didn't necessarily have. So please use the Q&A session to ask me of anything related to both science and career development. And I know that also Ms. Diamond will be talking to you more specifically about Stanford. And I'm happy to talk again also about my experience at Stanford, which hasn't been from the graduate level, but overall science and research experience. So without further ado, Thank you, Dr. Maldonado, again for that kind introduction. And as my talk is entitled "With Changes in Human Brain Function and Structure in Relation to Experience during Typical and Atypical Development," I'm gonna try to convey a coherent story, putting together a few of my studies that hopefully at the end give you a sense of why I'm so excited about understanding how experience as an intervention in itself can modify for very good the developmental trajectories of different populations. But before I start talking to you about my science, I want to provide you a little bit of background of myself and to help you understand what has been my both personal and academic trajectory. For most of my personal development, I grew up in this beautiful island, very tiny, so I'm highlighting it with a beautiful loving heart that a lot of you have also grew up in there or are familiarized. And for those of you that are not familiarized, it is Borinquen, or most popularly known as Puerto Rico. And during my time in Puerto Rico, I also did my undergraduate studies, specifically majoring in psychology. And during my last 2 years of my undergraduate studies, I was very happy and honored and lucky to have this fabulous opportunity that many of you right now, almost 10 years later, are experiencing. And that's specifically having this 2-year NIH-funded fellowship that in our institution is called Neuro-ID, but I know that other institutions across the nation has a similar program. And the very first year of this one, or cohort, started in 2011, and I was part of the first cohort, specifically in the UPR, University of Puerto Rico, the main campus, and I was under this program from 2011 to 2013. And not because I'm talking to you all and because I was invited by the co-directors of the program, but I truly believe and feel and has experienced that thanks to Neuro-ID, I had the perfect springboard to many of the other achievements that I have experienced in my trajectory, mainly career-wise, but also personally. And during my time in Neuro-ID, also in between, I did a summer program that I bet all of you or most of you has experienced already or are about to. And I did specifically my summer research experience at New York University in 2012. And upon graduation, since I was transitioning from psychology to neuroscience, and I wanted to enhance my experience in the neuroscience per se, and adding more coursework as well as research experience, I benefited from an NIH fellowship that is focused on a post-baccalaureate experience, and you can do it both intramurally or extramurally, and I did it extramurally specifically at the University of Pennsylvania for a year. After that, I officially continued my PhD in neuroscience at Georgetown University Medical Center, where I spent 5 years. And upon graduation of my PhD, since mid-2019 and on, I've been doing my postdoctoral fellowship at Stanford University School of Medicine. And to provide you an understanding of what are my research motivations and overall career goals, over the course of different research experiences, let me tell you that actually they started more in the context of behavioral neuroscience, working with animal models, and also different subfields of neuroscience. But overall, the more and more I progressed and dove into the neuroscience research and understanding of the brain, the more I got very passionate about neuroplasticity, and also in the context of experience, how experience is such a strong modulator and can be a great source of influence for good or for bad. But the idea is to use it for good, and how we can use, as others use perhaps pharmacological approaches or behavioral approaches, how from my own interest I can use experiences to perhaps intervene in the development of different populations, both with typical and atypical development, to enhance their developmental trajectory. So in here I am showing you a more or less cartoonish way of a lifespan, all the way from conception to late adulthood. And in this timeline, I'm trying to show you, roughly speaking, some key or sensitive periods of life, mainly at early stages of development. and how basically from conception and on, our brain starts developing, and from very early stages, how the brain can be modulated is a key factor or an interest to me. As I mentioned, neuroplasticity. And ultimately, after birth and on, how as the brain develops, also ultimately it gives a kind on how our behavior / cognition will develop. Today, even though that I'm very interested in different aspects of development, I will be very focused on aspects of learning and language abilities. Since that has been most of the work that I have done, that doesn't mean that I am not interested in other aspects of development, but certainly language is a key component of human development. And just to provide you an example, I don't know if you guys are familiarized, but actually speech hearing starts from gestational ages, from the fetus stage. And as we start hearing speech, and then we're born, also we start learning words. And then we learn from language to written language, or from spoken language to written language, and we learn to read. And ultimately, we use this ability that we have acquired, in which from spoken language, we ultimately end up in reading or written language. And all these abilities had their own sensitive periods throughout development. And that's why I'm very interested in the importance of early experiences, because the more and more we are trying to understand or going back in what is the neurobiological development and implications for human development, we see that the younger the human stage, the more sensitive they are, both behaviorally and neurobiologically / psychologically as well. And in the context of my own training and research, I did my PhD work at 2 different developmental stages, if one will say, one during childhood and one during young adulthood. Now as a postdoc, I am going even to younger stages, and I'm working with populations spanning from birth all the way to 2-year-old. And ultimately, my own career interest is to establish my own lab in which we can really focus on those first 10 to 12 years of life, and having a collaboration or an integration of both neurobiological and behavioral approaches to ultimately help us understand how different key early experiences modulate the developmental trajectories. So to give you an understanding of what I'll be talking to you today, and I hopefully don't lose your attention, and even more that I don't see your faces and I don't know what's happening, I want to first provide you just 2 studies. I was really debating on what to present to you from all the different works that we all have, but I think that at least providing you 2 studies from my doctoral work and 2 studies from my doctoral and postdoctoral work hopefully will englobe this notion of my interest in early experiences and their implications for neurobiology and behavior. And starting with my doctoral work, one of the 2 studies that I'll be talking to you about is one that was looking at what was the role of early dual language experience, specifically in the functional brain basis of reading abilities in typical development. And the second one, very similar, but instead of looking at reading abilities, is looking at the role of early dual language experience in the functional brain basis of arithmetic abilities in typical development. And as for my postdoctoral work, one of the 2 studies that I want to show you addresses the role of early maternal speech exposure for long-term brain structural connectivity and language outcomes in atypical development. And specifically, the population of interest that I'll be talking to you about will be infants born preterm. And the second study, it's looking at the role of early skin-to-skin holding or kangaroo curl experience for both short-term brain structural connectivity and long-term language outcomes in atypical development. So starting with my doctoral work, as I mentioned, I'm gonna be talking to you about 2 very related studies that in the context of experience looked at this unique dual language ability that some humans experience. And I know that in our audience today, there are many individuals that are bilingual or even multilingual. And we wanted to know how this, in the context of early acquisition of this experience, it may impact functional brain systems that are related to learning abilities. And those two learning abilities that I was assessing was, on one end, word reading or reading abilities and simple arithmetic. And stepping back a little bit on understanding this construct or even behaviors that I was looking at, we know that both written language and arithmetic are cultural inventions. But these cultural inventions have been so well adapted in our species that they are key cognitive processes that have become very important for different aspects of our development, including academic achievement and even personal growth, and very relevant for learning. And from the neuroscience or neurobiological standpoints, using many different forms of brain imaging techniques that are available within the context of cognitive neuroscience, as well as data from behavior, different groups have come up with what is considered a brain model for word reading, that it's primarily focused on the left hemisphere of the brain and comprised by three main areas in the cortex. I hope that you can see my cursor, but in yellow we can observe what is considered the occipital temporal cortex, very engaged during visual word form processing or orthography. We also have in red the temporoparietal cortex, which is more key for phonological processing or sounds related to language, both written and spoken, and also regions in the inferior frontal cortex that has been associated with both semantics or meaning, as well as phonology or sounds. This is in the context of word reading. Similarly, in the context of simple arithmetic, different studies have been put together both from behavioral and neurobiological standpoints to come up with what is a brain model of simple arithmetic. And similarly to that brain system for reading, there are some shared regions or similarities in these two systems, in which we have also in yellow the occipital temporal cortex related to visual Arabic code processing, as you may imagine, the symbol of numerals, and parietal cortex areas as well as perisylvian areas in red that are associated with more semantic or quantities processing, as well as verbal code or the linguistic aspect of making arithmetic in your brain. In comparison with reading, this system also involves subcortical regions, including the basal ganglia and thalamus, more related to automatic memory, if we will say, of these simple quantities or arithmetic problems. And ultimately, there's an engagement of areas of the inferior frontal cortex and the prefrontal cortex, which is more engaged in higher level processes like strategy, choice, and planning. And ultimately, stepping back and looking at the big picture and why this may be so key, understanding this bilingual experience in the context of learning abilities and their implications in the brain, at least looking in the context of the United States, the nation that we are right now, in the US, there is a large population of people that has reported that speak another language than English at home. And as you can observe in this graph, even though that we don't have the full completed data for 2020 yet, but across decades, you can observe that this population is increasing and increasing. And from this bilingual or multilingual population, the larger bilingual population in terms of linguistic group is specifically Spanish-English bilinguals. And that's why throughout the rest of these studies, I will be talking to you in the context of specifically Spanish-English bilinguals. And I make this very clear because I know that some of these results and even experiences could look differently depending upon what is your combination of languages, involving not only alphabetic languages, but logographic or other non-alphabetic languages. And putting in the context why people in the first place have been interested in understanding whether this dual language experience have any effect in the brain is because behaviorally, a lot of people that has compared bilinguals with monolinguals mainly in the context that perhaps this constant juggling, as you can observe from my image, perhaps constantly juggling two languages or two constructs in your brain, and even more when it's in correlation with proficiency across life, has developed this population to have perhaps heightened or better skills than someone that doesn't have this experience. And behaviorally, they have seen that bilinguals relative to monolinguals are better at executive function, such as task switching or working memory or even inhibitory control. However, does that mean that they also have a different neurobiological profile if one will look at their brain function while doing this task? So a lot of these have had a lot of media attention, having headlines like the amazing benefits of being bilingual, or is bilingualism really an advantage? And even put it in the context of other constructs like social skills. And coming back to why this may be perhaps an early experience that has also a direct modulation in our brain function development, when we look at these three different systems coming from the executive function, which is what has been primarily tested in the context of bilinguals versus monolinguals behaviorally, you can observe across the executive function, reading, and arithmetic system that there are more or less shared brain regions or structure, specifically in these two main cortices of the frontal cortex and temporoparietal cortex in red. Therefore, one of the studies that I carried during my doctoral work tested whether bilingual experience, particularly early bilingual experience, modulate the functional brain system for English word reading, specifically in Spanish-English bilinguals. And to do this, just providing a fast forward in terms of methods, but if anyone is interested in the Q&A session to dive more into the nitty-gritty of methods, feel free to do so. But I'm gonna try to keep it as accessible for everybody right now. And perhaps some of you have heard about magnetic resonance imaging, or even from the medical standpoint, but also from the research standpoint is highly used, because we can, with this magnetic resonance imaging technique, we are able to collect different set of pictures, if you will say, or sequences that can give you data either related to brain function, and by function I mean different aspects like activation or functional connectivity, or brain structure as well, that I will talk to you in the second half of the talk. But overall, as you can observe in this picture, typically our participants lay down in this big machine that is called the MRI scanner, and through different methodological parameters, we are able to collect very beautiful pictures and very valuable data from their brain. As you can observe here, we not only can acquire data related to their brain structure, but in the recent 2 decades, one will say, the field of functional MRI has grown significantly, because also we've developed parameters to understand the brain activity in humans, particularly using MRI. And in the context of this study, we had two different measures of brain function. One is what is considered local activity, which is which brain regions, if you will say, light up or turn on when you're doing a given task. In this case, both bilinguals and monolinguals were doing a task of English word reading. Also, we had a second measure of brain function. In this case, is considered functional connectivity, in which there's not necessarily an anatomical connectivity, but there's a correlation or an association between the activations of region A, region B, and region C. And it's in the same construct of English word reading and comparing groups of Spanish-English bilinguals with English monolinguals, in which we also had different age groups, because we were interested in seeing whether age had a role. So we had both cohorts of children and cohorts of adults. Focus now on our analysis of local activity during English word reading between bilinguals and monolinguals. We wanted to test whether there was any difference between these two groups when you compare them. And based on the background that we've observed based on others, we were predicting that bilinguals will show greater activity in regions of the temporoparietal cortex in the red circle and regions in the inferior frontal cortex in the left circle, or in the green circle, apologies. And we did not expect any greater activation from the opposite contrast, specifically monolinguals more than bilinguals. When we looked at our results, what we found is that neither group showed greater activation than the other one. And this is specifically in the context of local activation. When we looked at our second measure, which is functional connectivity, again in the same context of English word reading, comparing bilinguals and monolinguals, even though that there's no direct background literature out there to help us to predict, just extrapolating for what we have seen from the functional or local activity literature, we expected to see intercorrelation or functional connectivity between regions of the temporoparietal cortex and inferior frontal cortex, meaning red and green, and also within subregions of the frontal cortex or prefrontal cortex, which is the green one. And this specific prediction we were expecting it in bilinguals relative to monolinguals, and nothing in the opposite contrast, specifically monolinguals relative to bilinguals. When we looked at our analysis and our results, we did find that bilinguals compared to monolinguals had different functional connectivity, both positive and negative, and specifically those regions were between the temporoparietal cortex and occipital lobe, as well as regions in the inferior frontal cortex and the anterior cingulate cortex, which is more associated with executive function, as well as some negative or anti-correlation between regions in the inferior frontal cortex and the cerebellum, as well as regions in the inferior frontal cortex and orbitofrontal cortex. And when we try to summarize this and put it in the context again of testing whether early bilingual experience modulate the neurofunctional system for English word reading, and we look at whether we confirm or rejected our hypothesis, at the level of local activity, we rejected, but we did see and confirm that at the level of functional connectivity, bilinguals, at least in the context of early Spanish-English bilinguals relative to English monolinguals, seem to have modulation in their brain system for word reading. Moving now into the context of a similar but different study, in which we wanted to see also whether this population, given their early bilingual experience, had any modulation in their brain system for simple arithmetic in English, using the same samples of children and adults, also Spanish-English bilingual and English monolinguals. We wanted to look at local activity in this specific study, in which we were expecting to see perhaps differences in local activation between monolinguals and bilinguals, while thinking in arithmetic. Specifically, we had a task of both addition and subtraction. And relative to previous literature in which they have seen this frontoparietal activation, at least for executive function, and also in math tasks, but only monolingual participants, we expected to see greater activation in regions of this frontoparietal system in bilinguals relative to monolinguals, and nothing in the opposite contrast. When we looked at our results from this analysis, we did find that there was no major difference between the groups, specifically no greater activation in either group relative to the other one. When we go over again whether early bilingual experience modulate the neurofunctional system for English arithmetic processing, and we try to confirm or reject our hypothesis, we rejected, at least at the local activation level. We do not see a between group difference for this processing. Putting together these two studies and providing you with a general conclusion on early bilingual experience, in which we assessed whether it had any impact at the neurobiological level in two different constructs related to learning abilities, one being word reading and one being simple arithmetic, specifically in bilinguals relative to monolinguals. At the local activation, we did not see any modulation of early bilingual experience. However, at the level of functional connectivity, specifically for English word reading, we did see a modulation of this early experience, across different brain regions of the cortical system, as well as cerebellum. However, it remains to be tested whether also at the functional connectivity level, during simple arithmetic in English, we will see a difference between bilinguals and monolinguals. We haven't done this analysis, but we are aiming to do so. And as I said, this work was during my PhD time. There are many other studies that I would have loved to share with you, but I know that we only have a finite time today. But I want to emphasize that I did all this work thanks to many people, including my advisor here, Dr. Guinevere Eden. Brianna also was a graduate student that highly collaborated with me, mainly in the math study. This is my dissertation committee. The team in the Functional MRI Center, and Karen Gale, who is allied and angel for me. She's the founder of my PhD program. She's no longer with us, but thanks to her, I also was able to indeed fulfill my training in the program that I really wanted to be. So I'm gonna do a stop in here. And before I switch gears to my postdoctoral work, I'm gonna take a sip of water. And if anyone has a burning question that they think that if I continue, you're gonna lose attention, and I know that we have a thorough Q&A, but if there's any quick clarification question that we could address now, I'm happy to answer. If not, I will continue. Okay.
So, hi, my name is Gabriel.
Hi, Gabriel. I don't see you, but nice to meet you.
I can turn on my camera real quick. Hello. Okay. So, it was very interesting to see this anti-correlation that you saw with the prefrontal area and the cerebellum. Mm-hmm. And I think it's very interesting, and I want to see if you could expand on it a little bit, because there's like a lot of recent work in implicating the cerebellum in cognition, and specifically in it has some role in abstraction. And so I just wanted to get your thoughts on it, if you think that how bilingualism might be influencing that.
Yeah, thank you so much, Gabriel. That's a great question. Because actually someone in my lab, specifically Sequoia Ashburn, perhaps I can go back, Dr. Sequoia Ashburn now, her whole dissertation was just very focused on the cerebellum and the role of the cerebellum in word reading, not in the context of bilingualism. So I cannot tap so much on it. However, certainly this observation was very key and unexpected to us, and that led us to dive more into what perhaps is driving that. And we do know that particularly actually the right side of the cerebellum, there's more evidence coming out showing that it's implicated in reading and other language abilities, and perhaps it's more associated with different aspects like working memory or even motor control. And even though that I haven't dived into much detail of my task, one caveat is that as I've mentioned before, it's a word reading task. And in a word reading task, you are not, at least in the one that I use, you are not teasing apart all these different stages that happen when you're actually decoding a word or reading. It's all together. And the signal that I'm getting from the fMRI is just perhaps capturing the more higher level cognition of it. Putting together both of orthography, phonological decoding, and semantics, or representation of what it's meaning. And perhaps this anti-correlation is a reflection of that their cerebellum, it's actually in these more like step-by-step processes of reading, in which perhaps the cerebellum is engaged at earlier stages and needs to be anti-correlated or suppressed, while the higher level cognition structures in the prefrontal or inferior frontal cortex are engaged for more complex action, is what's leading these results. But I cannot make strong conclusions beyond that. I think it's really related to both our task and also the timing of these very fast processes, and fMRI doesn't capture these fine-grained step-by-step cognitive processes that happen. There are studies that actually develop tasks that you can actually tap in step-by-step, and perhaps in there you can see more like a causal relationship between cortical and cerebellar regions, but hopefully in the future we can understand better how the cortex and the cerebellum interact for this behavior. Thank you, Gabriel. And I hope that I answer a little bit of your question.
No, yeah, thank you very much.
Thank you. Okay, so I will continue with the second part of the or the talk, and with my postdoctoral work, and happy to open up the floor for more questions. So as I've mentioned before, in my postdoctoral work, I've been also working in multiple studies, and it has been almost 1.5 years of very exciting and fast-paced times, including the pandemic. But thankfully, I've been able to stay quite active. And I'm just gonna highlight 2 main studies that I'm working on, but there are many other ones that are related. So if anyone has more curiosity, happy to expand. But today I'm going to be talking to you about one study that is looking at the role of early maternal speech on white matter development and language outcomes, and another one looking at the role of early skin-to-skin holding, or kangaroo care, on white matter development and language outcomes. And to provide you a little bit of background as well, as I've mentioned over and over, I'm very interested in the impact of early experiences. And in the context of these experiences, some of them are proactively done, but many others are totally out of our control, including developmental insults or traumatic events, such as preterm birth, in which babies that are born before term are at risk of not only short-term, but also long-term poor developmental outcomes, given that they were born not fully developed in many regards. And that's why not only looking at infants that were born preterm, it's a key important field to address, given that this is a prevalent event worldwide, not only in our nation, but also it helps us to understand how early remediation / intervention can be very helpful. So it also serves as a model to also look at potentially or benefit other at-risk populations. And specifically diving into my current population of interest, I wanted to bring up a couple of overall key factors. One is that about 10% of infants in the United States are born preterm. And as I've mentioned before, infants born preterm are at a higher risk for neurodevelopmental delays. And even though that, thanks to modern medicine, we've been able to increase our survival rates in this population, the situation still that in the long term, depending upon what was the adequate follow-up and interventions for these individuals, we see later in life, mainly at academic stages and even adulthood, poor outcomes related not only to learning abilities, but overall cognition. And to give you just a crash course very quickly, understanding of also why specifically from all aspects of the brain that we can be looking at that may be negatively impacted by these insults, insults, such as preterm birth, and why I am so focused on white matter development. It's that from all the different aspects of neurobiology, white matter development is one of the aspects of the brain that get notoriously impacted very early on, primarily because these babies, so for all of you that are not so familiarized with the gestational ages, term birth is considered at 40 weeks gestational age. The longest that typically a baby can go perhaps is 42. So term is considered from 37 to maximum 42 weeks, but 40 is the kind of canonical term time. And but babies can be born as early as 22 weeks or even earlier. Younger than 22 weeks, the survival rate is very low. But we can have babies from 22 weeks gestational age all the way to 36 days and out of 7 days, and that's considered preterm. And very preterm is less than 32 weeks, which is the population that I study. And when you're born preterm, as you can observe in this graph, in which there's still a lot of neurodevelopment happening, there's a disruption of the development of your pre-oligodendrocyte cells, which ultimately promote myelination through oligodendrocytes. And when you have this disruption, of course, as you can observe, a baby that was born term relative to one that was born preterm, you can see how primarily myelination, but overall other aspects of white matter get very compromised and very susceptible to injuries because of all the lack of oxygen and inflammation and ischemia that happen due to premature birth. And the beauty of, again, coming back to brain imaging modalities and why this is one of the key tools that I use to understand the brain in developing populations, we are not only able to look at brain function, as I highlighted during my doctoral work, but now in my postdoctoral work, I'm very focused on brain structure, and specifically white matter can be assessed with different parameters that you use in your MRI scanner. And in here, I'm just showing an example of, even though that is colors, and this is just a way for you to depict your data, this is highlighting that we indeed can capture properties of white matter using magnetic resonance imaging. And now stepping back a little bit and also understanding these two experiences that I'm very interested in assessing in very early stages. One is maternal speech, and maternal speech has been very, very related or correlated with different outcomes, most of them very beneficial, including decreasing baby's apnea and brachycardia events or dysregulations with the cardiac system, and also increasing or enhancing their oxygen saturation, their weight, their feeding tolerance, and even more complex outcomes or long-term outcomes, including auditory cortex thickness, that, as you may recall from one of your courses, is very key to language. And as you can imagine, it has been shown to increase speech sounds recognition and even long-term overall language skills. So this is a key experience that I'm very interested in seeing, mainly at early stages, because our foundational studies show that on one end, yes, the fetus, it's already processing speech. However, from the research standpoint, most of the interventions or observational studies are at but relatively late stages. You may think that elementary school time is super early, but the more we learn about our development, it's just that there are rapid changes and drastic changes happening from birth to 2 years old. So that's why we want to assess whether even earlier exposures to maternal speech will lead not to only these clinical and more cognitive outcomes, but direct changes in brain measures such as white matter connectivity. In addition to maternal speech, also these individuals that unfortunately are born preterm are, depending upon where you are born in the nation, more and more, some hospitals, not only in the United States actually, but around the world, are creating these programs that are called developmental care. And these developmental care programs basically have an assortment on experiences that they consider may provide additional help or benefits to the overall treatment that these babies are experiencing while being in the NICU or hospital stay before they can get discharged and be at home. And some of these experiences involve music therapy or massage or talking or positive touch. But today I will be very focused on this one that has the red oval that is of great interest to mine, and it's considered kangaroo care. And it's kangaroo care. I hope that you can get the message with this picture, but ultimately kangaroo care means skin-to-skin holding. That relative to, for example, this holding in here with the lady in red shirt, in which, yes, you're still having the baby close to you. In here, there's such a unique proximity that involves not only holding, but it's a skin-to-skin contact that impacts temperature regulation, even may involve smell processing, cardiac rhythm, and many other benefits that people have been trying to understand. And some of these benefits that has been seen in correlation with kangaroo care or skin-to-skin holding have been decreasing sepsis or infection in these babies, also decreasing or improving basically their temperature regulation by decreasing hypothermia, also decreasing their time in the hospital, and also helping in their growth while they are recovering and being more stabilized in the NICU, and also improving their breastfeeding abilities, because depending upon how young they were born, the more difficult it will be to breastfeed. So they need to get there. And even in the long term, people have been recently trying to understand how this is helping this maternal infant attachment. That's what ultimately, hopefully, I can contribute also with my long-term work, in which we can understand not only behaviorally how this is happening, but also neurobiologically, perhaps with brain synchrony. So focus on the first study from these two, in which we want to understand whether early exposure to maternal speech modulate white matter development and language outcomes, specifically in preterm infants. Right now, there's an ongoing, so there's not much results that I'm going to show you. I'm still in my early stages of this work, but it's very exciting. In November 2019, and still in the process, we started recruiting and overall undergoing this amazing randomized controlled trial in the NICU, specifically here at the Stanford Children's Hospital, in which we're trying to have an intervention of literally exposing babies in the NICU through little iPods with their mother's voice during nighttime, which is when primarily they are deprived or not surrounded by a lot of adult speech. And ultimately, as you can observe from this basically study flow graph that I actually recently submitted as a manuscript in a study protocol approach in the context of open science, we can have not only this NICU and nursery stage, which is the one that involved the actual intervention, but also we want to longitudinally follow up these infants at 12 months of age, both looking at their brain measures of white matter and also language outcomes, and all the way up to 18 months old, specifically looking at our primary outcome, which are language abilities, including expressive and receptive language. And just diving into understanding this randomized clinical trial, as I've mentioned before, the idea is that we are providing these infants something that they are not only lacking because they're no longer in their mommy's belly. And as I've mentioned before, speech processing and hearing starts from embryonic stages. So that means that if you were born before term, you're already not getting what others will be getting naturally or typically. And on top of that, the environment that welcomes you, in this case, a very hectic and busy hospital setting involving the neonatal intensive care unit and then the nursery when you're more stable, none of them have an enriched environment of meaningful or relevant adult speech to the infant. So given what others have found, we're trying to provide this boost, if you will say it like that, in which we're supplementing maternal speech in the hospital nursery all the way to hospital discharge, in which right before their discharge to home, they not only heard their mother's speech every night in a typical cycle if you are in the intervention group relative to the control, but also we get a data point of your brain relative to this exposure. And then we can also follow up, or we are planning on following up with these infants at 12 months with another MRI. So we can look back and see whether there is any causal relationship, if we see any brain changes at 12 months. But ultimately, we also want to see whether this event, this early experience that happened so early, a year and a half later is actually benefiting, or perhaps not, these infants' language abilities, because this will be one of the first, if not the first, causal approach in a clinical, in a RCT manner, because other studies have been either at later stages of life or more observational or correlate or cross-sectional, but not longitudinal like our cohort. And even though that we are still ongoing with that project, one of my advisors, Dr. Catherine Travis, before I joined the team, while she was a postdoc, she had a smaller but very similar RCT. And from this one, I just want to provide you just a little flavor so we can be seeing some preliminary results that may look like similar or even more in our different sample and longitudinal approach. And in this case, with a different sample, which is not the one that we are addressing right now, when you look at the treatment or intervention group, which is the black line, with the maternal speech intervention relative to the control group who did not receive this maternal speech intervention, and specifically looking at a measure of white matter diffusivity, which is considered mean diffusivity. I can explain in more detail later if someone is very keen on teasing apart this. But to give you the overall message of it, we found that specifically in the superior frontal segment of the corpus callosum, which is one of our major white matter bundles from very early stages in life, in which there's not a lot of specialization yet for behaviors, but it's still very key for overall healthy development. We did see a between group significant difference, specifically lower mean diffusivity. In this case means healthier. I know that perhaps it's counterintuitive because we expect more, it's better. But in this case, this specific measure of white matter called mean diffusivity, less means better overall across development. And we see this improved pattern specifically in superior frontal areas of the corpus callosum in this intervention group relative to the non. So this is promising and exciting. But as I said, we're still needing to finalize our sample, and this analysis will be in the future. And wrapping up with our second and last study that I will be talking to you today, in which I'm trying to understand whether kangaroo curd or skin-to-skin holding modulate white matter development and language outcomes in preterm infants. As I mentioned, this experience is not only atypical holding, but the more we see these benefits coming from the clinical standpoint, we wonder whether this experience that, as you can observe and also experience if you do it yourself, it involves a multisensorial experience of smell, sensation, touch, temperature, and even infant-parent directed relationship. And again, sometimes experience is underlooked and its power is not highly considered relative to other approaches like pharmacological and behavioral that certainly are very key. But I want to highlight that also experience is very strong, and we've seen it in other brain measures. So that's what I'm trying to tackle now, whether just even in the long term of having this experience in the NICU and before you're discharged, is your brain having a more healthy trajectory given this experience. So this is something that is very much ongoing, as I can only talk to you about what we are doing, but still exciting. And as I've mentioned, similar to the previous study, we are very much interested in this heavy white matter bundle, which is the corpus callosum, that basically interconnects our two hemispheres and at early stages of development is very key for setting you up for a healthy or less healthy trajectory. And also, when you divided these very beautiful different colors, means that at the analysis level, you can literally look at the entire corpus callosum, or you can look at it at different segments, because we know that properties of white matter, including myelination, behave differently across the same tracks, either posterior to anterior or vice versa, depending your age time point. And basically, I'm looking at the corpus callosum, given that this overall structure is so susceptible both to injuries, but also to intervention/experience, or at least in older populations. So we're interested whether that happens also in babies. And at the level of measures, I'm going to be looking at two different white matter measures that speak of the connectivity or integrity of white matter. But since that is an ongoing work, from this parent study, in which I'm looking at the experience of kangaroo care in relation to brain, from that parent study, I did if you will say, a child study, in which I was also very interested. Before even understanding that potential relationship, we need to first understand whether this experience is happening in the first place, and if it's not happening, why it's not happening. And the motivation is coming because the more and more I got in contact with what is actually happening in the hospital and how this experience gets promoted among the parents of these infants, I noticed and learned that there are actually many barriers and disparities to have access to this experience. And some of these barriers come actually from the parent standpoint, either related to their resources or their network of support or their own beliefs or family acceptance. And these are things that we don't necessarily can control from the medical standpoint, and even less from the research standpoint. But on the other end, a lot of research has also found out that actually from the health system standpoint, there are also barriers coming and disrupting this ability that ultimately is benefiting or is supposed to benefit the infant. And specifically, it can be all the way from the type of resources that the health system has or the facilities, but also the workers themselves, the healthcare workers, including the whole clinical staff, not only nurses, and how their beliefs also influence, or their own biases have been observed to be some barriers for kangaroo care. And also it has been highlighted that other aspects just external to these two entities, including cultural norms, may be impacting the access to kangaroo care. And specifically stepping into the context of our nation, in which we're trying to see whether this medical practice that has been shown to benefit at least clinical short-term outcomes for this population is being accessible or not. We do know from other studies that both children and adults, specifically in the context of medical settings, and coming from lower socioeconomic status, are consistently less healthy than wealthier and more educated patients. And that's in itself a disparity just coming from a socioeconomic profile that shouldn't be impacting your healthcare, but certainly it is across the nation. And also in the United States, beyond socioeconomic status, language seems to be another barrier. For example, some have found that non-English speaking families in the NICU have been shown to be more susceptible to misunderstanding their children's diagnosis and their treatments, and overall understanding what is best for them, just because there's not a common understanding, literally just at the level of language, between parents and clinical staff. And a lot of these barriers actually happen not because there are not resources. For example, in Stanford, we actually have a translator, both either in person or in an iPad. And there are different resources that can be employed. But even when you have them in place, that doesn't mean that biases or time commitment is not playing a role. Therefore, there's an urge for more research to understand the barriers that are affecting this access to kangaroo care or skin-to-skin holding for preterm infants coming from families that are from low SES and non-English speaking backgrounds. So this is one of my babies, basically one of my very exciting recently submitted and now under review manuscripts. And in here, as I've mentioned, we look at two different disparities in kangaroo care relative to two factors in premature infants, specifically in the neonatal intensive care unit. It is currently available as a preprint in medRxiv and is under review under a peer review journal. But to give you a quick overview on it, I was very interested in looking at two factors, whether family SES and family preferred language to communicate with clinical staff influence the access to kangaroo care for very preterm infants in the NICU. And I assessed kangaroo care in 3 different metrics, since that's another aspect that's still very unclear in the field. What matters more, a total amount, like a big bulk, 200 minutes of kangaroo care and that's it, even if it was done in a day, or it's a matter of frequency, just even a little bit or a lot every day, but just frequency, or duration every time that it happens. So I developed 3 different metrics, and we hypothesized that very preterm infants whose families have lower socioeconomic status or communicate with clinical staff in a language other than English will receive lower amount, frequency, and duration of kangaroo care relative to their counterparts, specifically infants coming from higher SES families and families that communicated in English with the clinical staff. And looking at our results, specifically only with our sample divided as a function of family SES, specifically having higher versus lower socioeconomic status, we unfortunately found that across our 3 measures of kangaroo care, total amount, frequency, and duration, it was significantly lower for infants in the lower socioeconomic status group relative to the higher socioeconomic status group. And these very strong effects, statistically strong effects, were still present even when we controlled for key factors that may be biasing these results, including family visitation, gestational age at birth, and family language use. Looking at the other factor, which was what is the preferred language that family used to communicate with clinical staff, similarly, and unfortunately, we found that across the 3 metrics that I used for assessing kangaroo care, there was a significantly lower KC exposure for infants in the other language group, meaning any other language that wasn't English, compared to those in the English language group. And for most of these, primarily for KC duration, these significant effects, unfortunately, also persisted despite controlling for key factors that may bias these effects, including gestational age at birth, family visitation, and family socioeconomic status. And as you can observe, probably these 2 factors, family SES and family language use, are very confounded, at least in our current location in the nation. And to provide you a summary of this last study, in which revisiting our question, whether family SES and family preferred language to communicate with clinical staff influence the total amount, frequency, and duration of kangaroo care for very preterm infants in the NICU. Looking at our hypotheses in the context of our results, we confirmed that unfortunately, very preterm infants whose families have lower socioeconomic status or communicate with clinical staff in a language other than English received lower total amount, frequency, and duration of kangaroo care compared to infants whose families have higher SES or speak English to clinical staff. And providing you just a few bullet points to summarize, through this very key study that we put out there, we confirmed that disparities in kangaroo care are not only explained by the frequency that families visit these infants, because we control for that factor, and we still see this statistically significant difference between the 2 groups. Also, our findings are consistent with previous studies that have examined the contribution of socioeconomic or sociodemographic factors to parental involvement in kangaroo care activities. Also, given our results, we promote and argue that both of these 2 factors, family socioeconomic status and family language use, should be individual factors or targets for future studies in the context of intervention to hopefully ameliorate these disparities that we are observing, at least in our current context related to kangaroo care. And just to put it out there, you may imagine that if these disparities are so key and obvious in a context like where I am doing my research, which is one of the most resourceful centers in the nation, one can wonder how it's looking for others in less privileged contexts in the nation. And lastly, we are promoting and arguing for a family medical staff communication improvement, in which perhaps having a more family-centered approach in the NICU will improve this equity issue that we are observing beyond equality. I think that the aspects of equality, which is just providing to everybody the same, has been more or less nicely addressed, but equity, which addresses more what each individual or each family needs to achieve the same outcomes, has been a little bit more underlooked, and hopefully with this work and similar others, we can expand it. And with this, I want to wrap up, and looping back to the beginning, I hope that with this conversation and brief summary of almost 10 years of work, I can convey to you my great interest for the importance of early experiences, and not only for my own interest, but overall, regardless of what is your own subfield of interest, there's a beauty on utilizing and studying experiences as a modulator or as an intervention that hopefully will help different populations, both in typical development, but also at risk, to be reset and re-guided to a more healthy developmental trajectory. With this, I also want to acknowledge my current teams at Stanford University. I'm affiliated to the Developmental Behavioral Pediatrics Research Team, and I want to be very grateful to my two co-advisors there, Drs. Heidi Feldman and Catherine Travis, and also in the psychology team, Dr. Ian Gottlieb, as well as the NIH for supporting me with their funding, and Dr. Alan Rees, who is the director of my career or training program. Thank you so much to everybody for listening. Thank you.
Gracias, Edith. Well, since we are a little bit short of time, we're going to follow toward Kalai's presentation on Stanford, and then maybe hold some questions later, if those of you want to stay a little bit later. So, Edith, can you stop presenting so Kalai can present the information about Stanford? Thank you.
So, okay, let's try this. Give me 1 second. Okay, I'm almost there. So I think I want this one, but I'm not on the right slide. So let me start here. So do you only see my main slides?
Yes, we do.
Perfect. Okay. So thanks so much for having me join you today. My name is Kalai Diamond. I'm the Senior Student Services Officer and Administrative Manager of the Neurosciences Interdepartmental Graduate Program at Stanford. So a little bit about our program. Our program is interdisciplinary training leading to the PhD in neuroscience. Our primary goal is to train students to become leaders in neuroscience research, education, and outreach. Our graduates will be innovators, investigators, and teachers whose programs and pursuits are founded in research. We like to say that the signature feature of our program is the combination of outstanding faculty researchers and exceedingly bright, energetic students in a community that shares a firm and long-standing commitment to understanding the nervous system at all its levels of function. So a little bit more about our program. We have 95 PhD students, equally split between male and female. We have about 30% underrepresented minority students. And you can see the rest of the distribution there. We have about 100 faculty, and the reason why that's not a firm number is, as an interdepartmental program, we're not a singular department. Instead, we have faculty from a variety of departments and programs across the university who affiliate themselves with our training program. And so as faculty are hired at Stanford or kind of get to know about our program, they may decide to affiliate themselves with us. Our faculty come from schools across the university, mostly in the School of Medicine, but we also have faculty in the schools of engineering, humanities and sciences, the School of Education, and the School of Law. Within these schools, we have faculty from over 25 departments, and you can see the variety that's represented here. This adds to the breadth of research areas which we can draw from, and the faculty with whom our students can work and train. I wanted to give you a quick overview of our curriculum and kind of how the path to the PhD works at Stanford. So you'll see in the first year, we have what's called the Stanford Intensive Neuroscience Bootcamp. That happens within the first week or two of your first year in the program. We have what's called first year faculty talks. And so these are weekly dinner talks where first year students get to meet faculty in a group setting. The faculty talk about their research, their path, into academia, and just some kind of chit chat. And it helps the first year students explore different labs in which they might want to rotate in their first year. And then all first year students do at least 3 lab rotations. They complete what we call neuroscience core modules. There are 8 core modules. Each is 2 or 3 weeks long, and 2 or 3 modules are scheduled sequentially in autumn, winter, and spring quarter. And they cover development, systems, molecular, anatomy, cognitive, computational, genetics, and cellular neuroscience areas. At the end of the first year, our students will select their lab for their thesis work. In the second year, they'll move on and complete some more coursework, some more course requirements. The qualifying exam is completed by the end of the second year. Coursework continues in the third and is finished by the fourth year. And it's not that there's a lot of courses that you have to take. In fact, we don't have a lot of course requirements other than the core modules. Everyone takes responsible conduct. They take 1 statistics course. And in terms of advanced coursework, students must complete a minimum of 3 upper level courses that may be selected based on your interests and your needs, and as they apply to your own research. So all the coursework should be complete by the end of the fourth year. And then, you're doing your own thesis research at the same time. You're attending seminars, maybe going to some conferences. And so around the 5th year of the program, students are typically ready to complete their degree. We do require at least 1 first author publication, and then students do an oral exam or a thesis defense, and then they submit their written dissertation. All admitted students are provided with a living stipend, tuition, and health insurance for the duration of their PhD degree. The current stipend amount is $45,792. Subsidized on-campus housing is available to all students. We encourage our students to apply for individual fellowships, such as the nationally competitive awards. And there are a few competitive Stanford fellowships, the Stanford Graduate Fellowship. SIGF is the Stanford Interdisciplinary Graduate Fellowship, BioX Graduate Fellowships, and DARE stands for Diversifying Academia Recruiting Excellence. That's a fellowship specifically for underrepresented minorities. Conference travel funding is available for students in our program. And in terms of teaching assistantships, we encourage them, but is not required. So why is Stanford Neuroscience a program you might want to look at? From a program perspective, it's interdisciplinary and interdepartmental, as I mentioned before. We have faculty excellence in research and mentorship. Our faculty are leaders in their field. They're innovators, Nobel Prize winners, but they also put a lot of time and effort into mentoring graduate students. They serve as first-year advisors. We have a lot of students who have co-advisors, so they can benefit from dual mentorship in that way. We have what we call informal mentors, faculty who just make themselves available to graduate students who they themselves are not supervising. And every year, PIs will do an individual development plan with their trainees. And so that's an opportunity for students to sit down and kind of map out where they're at, where they want to go in the coming year, and ensure that they have the support they need in that process. Our students are highly engaged in the program at all levels. They sit on program committees, so we have students on our curriculum committee, on our diversity, equity, and inclusion committee, and we have a student program committee that kind of takes a pulse of what the students' needs are and communicates that to program administrators. They coordinate mentorship programs as well as events and activities for the community. So they prepare a first-year mentorship program. We have what's called a Neuro Student Network, where they lead workshops over the course of the year to help other students in earlier years prepare for these milestones, like picking a thesis lab or taking their qualifying exam. They do research and projects talks. We have student-led journal clubs. We also have a group called Neuro-ID West. Neuro-ID West is a group of scientists interested in writing and writers interested in science. And so what they want to do is they want to make science, and neuroscience in particular, accessible to anyone who's curious about the brain. And so they write articles, they help other students with their writing and presentations. And so it's just really a great community where everyone is engaged and supporting one another. On a broader level, Stanford has extensive research groups and resources to motivate and support students. Stanford Biosciences is comprised of 14 home programs. There are 9 departments and 5 interdisciplinary programs, which are the School of Medicine and the School of Humanities and Sciences. These 14 home programs have everything for our biochemistry, biology, bioinformatics, cancer biology. I'm just going to read off some of them. Molecular and cellular physiology, stem cell biology, and structural biology. And so what happens is each student is admitted to a particular home program, and that program initiates your training, and you work with those core faculty and students and postdocs. But in addition to your home program, all biosciences students have access to faculty in every home program. The Wu-Tsai Neurosciences Institute is dedicated to understanding how the brain gives rise to mental life and behavior, both in our health and in disease. The Wu-Tsai community draws from and informs multiple disciplines, including neuroscience, medicine, engineering, psychology, education, and law. Stanford BioX is Stanford's pioneering interdisciplinary biosciences institute that brings together biomedical and life science researchers, clinicians, engineers, physicists, and computational scientists to unlock the secrets of the human body. So you'll see that within Stanford Medicine, it's completely interdisciplinary, and there's a lot of cross-research going on. And really, once you're part of the community, you can reach out to any faculty or researcher who's there. Diversity is a core value at the Stanford School of Medicine. Our goal is to draw from people with a variety of backgrounds and life experiences to reach a new level of innovation in teaching, research, and caring for patients. And so I just highlighted here some of the core programs that support graduate students in biosciences and in the neurosciences program as well. BioAIMS is an inclusive organization that provides a welcoming home for all biosciences students to celebrate in their identities, especially those that have been traditionally marginalized in academia. They build their community through cultural celebrations, peer support, and career development programming. To address issues facing our communities, we engage in social justice advocacies and local outreach activities. BioPeers are graduate students in their second year or higher who have volunteered to help their peers cope with feelings of stress, inadequacy, or uncertainty that are often experienced during graduate school. PRISM is a program that helps underrepresented graduate students to explore the training environment for postdocs and decide whether advanced training at Stanford would support their career goals. DCOR is actually a physical space where any member of the Stanford medicine community who's interested in issues of inclusion and diversity can have meetings or just hang out and study together. The Solid Mentorship Program was actually initiated by graduate students in the biosciences, and it connects students with faculty who can provide additional mentorship to support students on issues that may be largely outside their research, such as advocacy, diversity and inclusion, academic activism, mental health and wellness. And so these are, and there's so many more of these, but I wanted to share a little bit about kind of the broader set of resources that are available to students in the neurosciences program. So a little bit about our alumni and where our trainees end up. So our trainees are not driven to any particular career choice. Our goal is to provide opportunities that place students in the strongest position to obtain their job of choice. So you'll see overall, the majority of our graduates do go into academia, include the institutions listed here. We also have some physicians who went through our medical scientist training program and completed an MD, PhD. You'll see we have representation in business and industry as scientists and consultants, as well as some graduates who went into law. And we do have a joint degree program with the law school, a JD PhD program. As well, we have graduates who went into journalism, communication, finance, and government organizations. Let's see, so beyond the Stanford campus, we're located in Northern California in the city of Palo Alto. It's pretty much right in the middle in between the city of San Francisco and the city of San Jose. The temperature is moderate, although it does get a bit colder than in Puerto Rico in the winter. I grew up in Hawaii with a climate similar to yours, and I find it pretty comfortable here for most parts of the year, especially compared to the Midwest and the East Coast. Beyond our campus, you'll have easy access to a variety of beautiful locations in the state of California and in Northern California. San Francisco is like 35 miles away, easily accessible by car or train. If you miss the beach, Santa Cruz is just a little bit further at about 40 to 45 miles away. Lake Tahoe is a little bit further, a few hours by car, but it's a great location for skiing or snowboarding in the winter and hiking and camping in the summer. And there's just a lot of parks and hiking and biking trails if you like being outdoors. And it goes without saying that in Silicon Valley, we're surrounded by companies advancing technology and innovation. So here's a little bit about the admissions process for our program. The deadline for fall 2021 was December 1st. So it's too late to apply for next year, but we can give you a heads up about what to expect for the following year. Because of the interdisciplinary nature of neuroscience, we welcome students with backgrounds in biological, computational, and psychology backgrounds, and all of those are equally appropriate. We do not require, so research experience is very important, but the exact disciplinary area is not as critical. We don't require the GRE, and we do offer fee waivers for applicants. And because we're part of the biosciences, applicants can apply up to 3 biosciences home programs within 1 application. As I mentioned, students in our program are highly involved in activities and want to support other up-and-coming neuroscientists as they navigate the application and graduate school process. SNAP is a student-run application assistance program, and they are offering advice to applicants to neuroscience PhD programs. There's information on our website if you want to sign up with them and learn more. As well, our students recently held their first casual Q&A via Zoom in November, and there'll likely be more of those coming up. I also wanted to highlight some other training programs. And so these are within Stanford Biosciences, and neurosciences is included with all of these programs. Let's start with SSRP Amgen Scholars Program. This is a fully funded summer program offering research experience, data workshops, GRE test prep, professional development, workshops, a journal club, application support, mentorship, and more. There's still time to apply for this coming summer. The deadline is February 1st. The Advanced Undergraduate Institute is a 3-day intensive institute sponsored by Stanford Biosciences and the Stanford Black Biosciences Organization. The AUI is designed to introduce diverse sophomores and juniors to the Stanford University campus and provide guidance in the graduate school admissions process. After completing the 3-day institute, students will then join the AUI network and engage with previous participants who are currently pursuing and/or enrolled in a PhD or an MD PhD program. And so the application deadline for that is January 20th. There are 14 PhD programs that you can apply to in the future. And we also offer the Advanced Summer Institute, which is for incoming biosciences PhD students from diverse backgrounds. So here are some links to key pieces of information that I presented to you today, and we'll make sure that you get them by email or in some form as well. I powered through this really quickly because I wanted to see if we had a couple minutes left for questions, but I wanted to thank you for your time today. If there's time for questions, I'm happy to answer them now. Otherwise, please don't hesitate to contact me directly.
Thank you, Galai.
Thank you.
Wonderful presentation. Very quick and bird's eye view of Stanford, which is such an amazing institution and so many resources available for our students. Well, we are at the limit of time.
We made it through.
Nonetheless, I'm gonna maybe have a couple of questions for each one of you. So, for example, this is for Kalai. There's a student saying, if you have research opportunities for students that are interested in social neuroscience, so that interconnection between both.
Yeah, I would say, you know, because we're so interdisciplinary, we do have a lot of faculty who are with psychology, and actually our students are reaching more into the humanities areas than before. So I would say you can definitely craft opportunities. If you find a faculty member that you're interested in working with, definitely reach out to them, and they might be really interested in what you have in mind.
Thank you, Kalai.
Mm-hmm.
We have shared your email with the students in the chat, so any other more specific questions about the program, you can contact Kalai, and then
Yes,
she'll,
please do.
of course, answer your inquiries. And so, Edith, we have a couple of questions, scientific questions for you. And there's one that's, well, there's several, so I'll have to choose, unfortunately. So one question is, would you expect the results that you found will obtain from in your study can vary if the babies are exposed to are the father's speech instead of the mom's speech?
Yeah, thank you, Cielo, for that great question. It's TBD in the context that two things. When you look at it, not in a control setting like ours, that is a specific intervention where actually mothers are not freely speaking. I should clarify that in this intervention, we record the mothers reading the Paddington Bear children's book, literally, so we have that controlled. And that way, we make sure that it's an enriching content. At the same time, we tell them to talk like if they were talking to their baby with that more like child-directed intonation or speech. And I can see how perhaps there's not a sex and gender differences if you also have fathers that do exactly the same thing because the content is the same thing. And hopefully if they follow our instructions in terms of intonation and child speech or child-directed speech, there may not be strong differences. However, that said, even in our control context, something that we cannot forget is just that, again, speech processing happens before birth and you are in your mommy's womb. So that by itself creates a difference. And that's why we emphasize and continue with mommy's voice, not only because of the research out there, but just developmentally. If there will be a benefit, likely there's a more continuation of that exposure. However, when you remove such control setting, and people have been interested between mothers and fathers, depending upon the setup, there are either similar risk findings or different findings, and the benefits are coming more from the mother's exposure because there seems to be a more variation in fathers that they either have less enriched vocabulary or communication with the infant or less child-directly intonation, whereas moms tend to be more rich and abundant and very baby level rather than the father. And that's a longer debate and conversation, I think, related to sex versus gender versus father versus mother. That I don't think that specific question will be answered with this RCT, but it's a wonderful question. Thank you, Cielo.
Yes, it's very interesting. And then there's another question from Claudia. She says, if parents speak mixing words of different languages in the same sentence to young children, how could that affect their development?
So I actually will ask Claudia to expand more on what she means by speak mixing words. Do you mean at the language level or which kind of mixing words, if you can chime in, Claudia?
A ver si Claudia todavía está. Let me see if she's still here. Claudia, ¿tú podrías clarificarle a Edith tu pregunta?
Hello, yes. So I meant when people speak more than one language in the same sentence. So they're using one word in English, then one word in Spanish, but it's all like the same sentence. that's more of what I meant, instead of one sentence in one language and then another sentence in a different language.
Yeah, thank you. So I'm gonna try to actually combine your question with Cielo's, another Cielo's question that was very beautiful and I loved it, which is in the context of Spanglish, that we all that grew up in the island at key stages in our lives, we've been very heavily exposed to Spanglish and these constant intermeets. One thing is what happened in the naturalistic setup, and another thing is what we test at the research level, in which I kept both languages separately, and at least at the level of the two studies that I presented to you, which wasn't necessarily a population from Puerto Rico, for example. It was within the States and with people coming from different Spanish-English backgrounds that do not necessarily replicate the Spanglish intermeets. We try to address, to do not pay too much attention to that, but make sure that their academic level, for example, in both languages were equal as a reflection of their proficiency. And I think that this Spanglish situation that also Cielo brought up as perhaps a more complex issue at the brain level of internal conflict, this research cannot answer that. And perhaps there's some situations in which it's confounded with the proficiency and you're relying on whichever vocab you have in English and whichever vocab you have in Spanish, and you're just using the grammatic of Spanish to use it. That's why we were able to control slightly for that, just making sure that our participants were highly proficient both at the spoken and written level for English and Spanish, and that they were exposed very early in life, or let's say before age 6, because those 5 years of life has been shown to be very key to determine aspects like proficiency and accent relative if you learn it later. Let's say you learn Spanish or English in the university or later in life. That's where I can see a lot of the construct that Cielo brought up related to an internal conflict. But I think that this Spanglish that we're seeing more and more is also a reflection of cultural influences. Puerto Rico is a beautiful place in many regards, and it anthropologically and linguistically is being enriched by two, like an Anglo-Saxon and Hispanic perspective. And that doesn't necessarily mean that you have a problem. I think sometimes we are literally even lazy. I can see myself, I can only speak for myself, and this is more anecdotal rather than scientific, how if I really put attention and tune myself to only talking English or only talking Spanish, it's a matter more of attention rather than having a problem when I'm talking in Spanglish. I think it's more a reliant on cultural aspect rather than a problem. I hope that addressed that.
Okay. We have one last question that Omar, Omari's had the hand raised. Dime, Omari, can you share your question?
Yes, my question is more about degrees, like, so it's not the scientific aspect of Stanford. I wanted to know if the JD PhD programs that you have, if there's one specific that's a PhD for neuroscience, like the JD PhD in neuroscience.
Yes, it is specifically a joint program with the neuroscience PhD program and the JD program.
Okay. And where can I find more information about that program?
So it's on our program website, and it should be on the law school site as well. Basically what you do is you apply to both programs in the same year and indicate that you want to do the joint program. And then, you know, when you're admitted to both, we would work with both sides of the program to determine kind of what your training plan will be, when you'll start the JD versus the PhD, and how you'll split your time over the years that it'll take to complete them. But go ahead and visit our website. And if you can't find it, email me.
Okay, thank you so much.
You're welcome.
Okay, I think this wraps up the event. I want to thank very much Edith and Kalai for being here today and sharing not only science, but a very different and wonderful opportunities that Stanford has to offer our students. And to Edith, always my affection and my lots of vibes for you to continue being as successful as you've been, and being a role model of a young and and intelligent neuroscientist and woman neuroscientist, which is very important.
Thank you so much.
Representing us everywhere you go. And so for our students, it has been a pleasure. And then please come back next week for the last talk that we'll have for this year. That we'll have Dr. Chris, let me see what's her name. I forget her name, but now I will. Christina Nielsen from Johns Hopkins that will be here next week. So thank you all for being here. Have a wonderful day for you in California, for evening for us. And then we look forward to greeting you once again some other time.
Thank
you so much.